Hi, Jeremy. Thank you so much for coming in today.
Hi, thank you.
So today we're going to be doing a head-to-toe assessment. So that basically involves a quick overview from head to toe of your health and how you're feeling, and if anything sticks out, we'll look into it further.
Sounds good.
Great. So I'm just going to take some notes and ask you a few questions about your health history. So quickly, could you just tell me your first name?
Jeremy.
And could you just confirm your date of birth?
January 1st, 1988.
Perfect. Okay. Just making sure we have the right person here. So, do you have any overall issues with your health?
No, not really.
Feeling pretty good.
Yeah.
Are you in any pain right now on a scale from 1 to 10, 1 being no pain, 10 being the most pain you've ever had?
I'd say 1.
1, so no pain.
Yeah.
Great. Okay. And tell me a little bit about your overall health. Do you exercise?
Occasionally, yeah.
What do you usually do for exercise?
Sometimes I go to the gym, lift weights, sometimes run on the treadmill, do some cardio.
That's great. And how often do you do that? How many times a week would you say?
I try to go 2 to 3 times a week.
That's good, yeah. And just try and, take walks on those days that you don't get to the gym. Just keep your body moving. And then what about your diet? Do you generally, what do you generally eat in a day?
I eat fairly healthy. I try to get my vegetables in when I can.
Okay. And do you have any issues with any foods, any allergies?
No, not really.
Okay, excellent. And no stomach problems with eating?
No.
Okay, cool. How about sleep? How are you getting, how much sleep are you getting every night?
I try to get 7 to 8 hours a
7
night.
hours?
Yeah.
And does that feel like enough for you?
Yeah.
We never quite get enough, do we?
No.
No, okay. Just make a note of that. But it seems like, you're alert. You don't look incredibly tired. You're not drawn out. So I'm glad that you're getting at least that 7 to 8 hours. That's ideal. Some people need a little less. Some people need a little more. So. And have you had any illnesses, injuries, or surgeries in the past 5 years?
No, I haven't.
Okay, great. Okay. And do you have any questions for me before we start the exam?
No.
Okay, excellent. So I'm just going to start off with some vitals. I'm going to start off by getting your temperature. So if you can just open your mouth and put that under your tongue. There you go. You can hold that there. And while you do that, I'm just going to go ahead and check the pulses in your hand. Okay, excellent. Next up, I'm just going to go ahead and check some of your other vital signs, get your blood pressure. Do you have a preference of which arm you like to use?
No.
Okay. Go ahead and stick that arm out for me. So you should feel a little bit of pressure. If it gets to be too much, just let me know. Okay, excellent. Pressure is very good. Okay. Next, I'm just going to go ahead and start the head-to-toe assessment. Is it okay if I touch you?
Mm-hmm.
Okay, so I'm going to start by just looking at your head, looking at your hair. Do you have any pain when I do this? Touch your palpate?
No.
Okay. Hair looks clean. No pests or bugs. No dandruff. Okay, and I'm going to just check your lymph nodes here. So let me know if you have any pain. Down the back of your neck. Can you shrug your shoulders for me? That? Okay. Excellent. I don't feel anything there. And then I'm just going to go ahead and look into your eyes. So go ahead and just look right at my nose and ignore the light. follow my pen light with the tip of the pen light as it goes. Don't move your head, just move your eyes. Okay, any double vision with that? Okay, go ahead and look at the tip of my pen and follow it as it goes in. Good. Pupils constrict and react to light and accommodation. I'm going to go ahead and look into your ears. So if you just turn that way. Okay, looks good. Any pain when I palpate the outside of your ear here?
No.
Okay, other side. Any pain there, like that?
No.
Do you have any issues with hearing or hearing loss?
No.
Okay, I'm going to go ahead and make some soft noises next to your ears. Can you close your eyes and tell me which side you hear it on?
Left. Right. Both. Left. Right.
Very good. Okay, so it doesn't seem like there's any issues there. I'm just going to take a quick look into your nose. It's going to involve me gently placing my hand on your nose. Let me know if it hurts in any way. Okay. Do you have any problems with smell or taste at all?
Not really.
Can you go ahead and breathe in that nostril? And breathe in there? Okay. Any issues with blockages or...
I have slight allergies.
Slight allergies, okay.
Yeah.
Do you feel like it comes and goes, or does always one side?
Comes and goes.
Okay, that's pretty normal. I would say like most people will have some occlusion on one side or the other throughout the day. As long as you're not feeling like you can never breathe through one nair or the other, then it's not really cause for concern. I'm going to go ahead and look in your mouth now. Could you open up wide and say ah? Excellent. Do you have any problems with pain in your teeth or anything like that?
No.
And when was the last time you went to the dentist?
Several months ago.
Okay, good. So you go like every 6 months or
Yeah,
so.
I try to get my checkup.
Good, excellent. So that all looks good. I'm going to go ahead and check some of the nerves in your face now. Go ahead and can you smile for me? And frown. And lift your eyebrows up. And can you puff out your cheeks? And don't let me push them in. Good. Okay, I'm going to check some sensation as well. Just go ahead and close your eyes and tell me when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it.
Good. So cranial nerve is intact. And can you go ahead and clench your jaw for me? Sort of clench down. Do you ever have any problems with your TMJ? Any clicking? Any popping?
Occasionally.
Open and close for me. Okay. Yeah, I feel a little bit of clicking and popping. Does that bother you quite a lot, or?
No.
No, it doesn't bother you too much. It's not too bad. It's not too pronounced. If it gets worse, go ahead and let me know. Okay. And then I'm just going to do a couple other things. Can you go ahead and shrug your shoulders for me? And against my resistance? Good. And then try and turn your head against my hand. Good. And this side? Good. And push your tongue inside onto my fingers. And then over here. Good. Okay, so good strength all around. Your face looks symmetrical. Your eyebrows look good and healthy. The facial hair looks very healthy and doesn't have a lot of ingrown hairs or anything like that. And the lips look good, not too dry or chapped. So, and the lips look good, not too dry or chapped. So that all looks good. I'm just going to take a look at your neck now. I'm going to go ahead and just look for the pulses. Okay, I'm going to go ahead and feel now, one at a time. The other side. Good, nice, strong. I'm going to have a quick listen. You can breathe normally. Okay. Good. Okay, so no bruise, nothing loaded there. That all sounds good. So I'm going to go ahead and move on to your arms now. I'm just inspecting your arms for any lesions, bumps, lumps, rashes. The temperature is warm and consistent throughout the arm. Good. And down to your hands, cap refill, less than 2 seconds. Good, the other side. Warm to the touch, no blemishes. Cap refill Do you have any problems with the musculature in your arms? Any pains? Anything like that? Okay. I'm just gonna go ahead and check the strength in your arms. So if you can go ahead and put your arms up like this and prevent me from pulling, prevent me from pulling, prevent me from pushing, pushing. Good. Now with your hands, can you go up like that? Prevent me from pulling, prevent me from pushing. Good. And then just with your fingers alone, so like this. Open and close. Any pain there? You open your fingers wide. Don't let me push them in. You keep them closed. Don't let me pull them apart. Good strength. So you can go ahead and put those down. That all looks fine. 5 out of 5 for strength. If you have, any changes in one side or the other, if it wasn't symmetrical, we could look into it further. But you seem totally fine. I'm going to go ahead and check some sensation in your arms as well. Just go ahead and close your eyes and tell me when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Good. So next I'm just going to do a quick sharp and dull. So I'm just going to move this, it's not sharp, but it's not soft, all the way up and down your arm, and just let me know if it feels differently at all. So, feels the same sharp all the way up? All the way up, okay. This side? Feels the same all the way up? Okay, good. All right, I'm just gonna move to your chest now. I'm gonna go ahead and listen to your heart and your lungs. So for your heart, you can go ahead and breathe normally. I'm just going to listen in a couple of spots. Okay, great. Don't hear anything abnormal there. Consistent pattern. And do you have any? Do you ever feel tired after you exercise for short periods of time? Anything that would be concern for your heart?
No.
Okay, I'd say that with good blood pressure means that there's really no concern there. So next, I'm just going to go ahead and palpate the front of your lungs. So that's just going to involve me tapping on your chest and listening to the sound of it. So if you have any pain or tenderness, let me know. Otherwise, you can just breathe normally. Okay, that all sounds good. So now I'm just going to take a listen, and I am going to have you take a deep breath in every time I move my stethoscope. You can also pretend. And one more. Good. Okay, now I'm just gonna go ahead and do the same thing on the back. If you can go ahead and just shift your body. Again, I'm just gonna be palpating, so let me know if you feel any pain. Now I'm just gonna take a listen. Go ahead and take a deep breath in. One more. More on this side. And last one. Good. Can you take a big breath in for me? And let it out. Good. Symmetrical expansion on both sides. Okay, you can go ahead and sit back down. So I'm just going to listen to your stomach for any bowel sounds. That all sounds fine. And I'm just gonna palpate a little bit. If you have any pain, let me know. Any pain there?
No.
Just gonna feel for your spleen. You can take a deep breath in and let it all the way out. Good. Don't feel anything, so that means it's probably not enlarged. So I'm just going to go ahead and inspect your legs, palpating for any lumps, bumps, any pain when I touch. Any pain here? No. Okay. Go ahead and check for, I'm just going to go ahead and sip this. Just check for temperature. Feels warm and dry to touch. Yeah. Warm and dry. Okay, excellent. Can you go ahead and put your legs up? Yep, like that. And pull, keep me from pulling. And push. Good. And you can put your legs back out and put your feet up. Keep me from pulling. You can put them down. Just put your, yeah, like that. And then push down. Good strength on both sides. Okay, so I'm just going to check some of your reflexes down here. So go ahead and put the weight in my hand. Good. Good. And sort of bend your leg out like this. Yeah, exactly. Good. And the other side. Good. Okay. I'm just going to go ahead and check the Babinski reflex. Just going to run this little piece up the bottom of your foot. Might feel a little odd. Good. Good. So I want the toes to curl inward there, and they did. So no sign of the Babinski. Go ahead and sit back up. We're going to finish up with your reflexes and then do a neurological exam. So I'm going to go ahead and check the reflexes in your arm. Go ahead and give me all the weight of your arm. Just go completely loose. Just completely relax your arm. Yeah, perfect. Good. And here, again, completely relaxed. Good. And right here. Good. Okay, on the other side. Again, just completely relaxed. Give me all the weight. Good. Good. Okay, so I'm just going to finish up with a quick neurological exam. So can you go ahead and take your fingers and move them one after the other, just like that. Good. And can you take your foot and slide it down your shin like this? And on the other side. Good. Okay. And lastly, I'm just going to go ahead and put something in your hand. I want you to close your eyes and tell me what it is.
Pen?
Yep. And I'm going to draw a letter in your hand. I want you to, or a number in your hand, and tell me what number it is.
2.
Good. And the other side?
4.
Yep. Perfect. Okay. I'm going to be doing an eye exam on you today.
Perfect.
So I see in your chart here you've been having some headaches or pains behind your eyes, and that's why you're here today. Is that correct?
Yeah, that is correct.
So can you tell me a little bit more about what's going on? What type of pain is it? Is it a throbbing pain, sort of a dull ache, more of a sharp stabbing pain?
I would say it's more of a sharp pain.
And which, are you getting it in both eyes or one eye?
I would say both.
Both eyes,
Yeah.
okay. What, on a scale from 1 to 10, with 1 being very little pain and 10 being the most pain you've ever experienced in your life, where would you say that falls along that scale?
Maybe a 7.
A 7, so it's pretty severe when it happens. And how often are you getting these headaches?
Maybe once a week.
Once a week, okay. And can you just show me by pointing to it where where area it occurs in?
Probably around here.
So just above the eyes.
Yeah.
Okay. And is it better or worse at a certain time of day?
Sometimes it's worse at night.
Worse at night, okay.
Yeah.
That's when, would you say like once a week, that's when they're mostly occurring, is in the evening? Is it like right before bed or like after work kind of time?
After work kind of thing.
So like the early evening?
Yeah.
Okay. I'm just going to write that down. Okay. Is there anything you do that makes it better or?
Usually I'll go lie down for a while, close my eyes.
Okay, and that feels better after you've had your eyes closed for a bit?
Yeah, I take some ibuprofen or something.
Okay, and is there anything that makes it worse?
Sometimes if I've worked long hours on the computer or something like that.
Okay, so if you're looking at something like a light for a long period of time. Okay. Okay. So I'm just going to do an exam of the eyes today. Take take a look, see what's going on. It's going to involve me looking into your eyes, checking with the light, as well as checking some of your visual acuity. If you have any pain during the exam, please let me know, as well if you have any double vision or any issues at, completing one assessment or the other. So just let me know if anything goes on.
Sounds good.
Okay. I'm just going to start out. I'm going to have you actually take a quick read of... Do you currently wear glasses, right?
I do, yeah.
You do? Do you have them with you?
I do.
Can I see them? And when was the last time you had your prescription looked at?
Maybe a couple years.
Okay, so it could be possible that they're a little outdated. Okay, I'm going to have you go ahead. Do you use them to read or do you use them for distance?
Sometimes I use them for distance.
Okay, so I'm going to have you put them on in order to do the Snellen chart. I'm going to have you get up and stand about 10 feet away there. And go ahead and read this chart.
Starting at the top.
Start with line number 3.
T-O-Z L-P-E-D P-E-C-F-D-B.
Very good. Can you read any of line 6 for me?
F-E-L-O-P-T-E.
That's good. Okay, you can go ahead and just tell me what color is the line under number 5?
That's green.
And what about the line under number 7?
Red.
Perfect. You can come ahead and sit down. Okay, you can go ahead and remove your glasses. So I'm just going to go ahead and check your eyes for perla, and that's reactivity to light and accommodation. So I'm going to shine a light into your eye. Just keep focusing on my nose here. So let's direct, sensual. Good. Go ahead and follow my pen light, the tip of the pen light. As it moves, don't move your head, just your eyes. Any pain with this?
No.
Any double vision?
No.
Okay, good. And go ahead and follow the tip of my pen as it gets closer to you. And far away. Good. Go ahead and look at the tip of my finger here, and then look at the wall behind me, and the tip of my finger, and the wall behind me. Very good. Okay. Next thing I'm going to do is just shine a light right in the middle of your eyes. I'm checking to see where it reflects in both your eyes. And it reflects in the same place. So that's very good. I'm just going to come around and look more closer to your eye, try to see the red reflex. So just go ahead and stare over my shoulder straight ahead. You mind if I just set my hand gently on your face? Okay, I'm going to go around the other side. Okay, so no problems there. I'm just going to go ahead and inspect the eyebrows. They are symmetrical. They feel like they have equal distribution. They end in the same place and they start in the same place. Is there any pain when I press here?
No.
What about on the sides here?
No.
And underneath in your sinuses?
No.
I'm going to just gently press your tear ducts here. Any pain there?
No.
Okay. I'm just feeling the eyelids, the eyelashes evenly distributed. Okay. And just up in here. You said the headaches occur like right in here?
Yeah.
Okay. And no pain when I touch that?
Not currently.
And can you feel this and this?
Yes.
Does it feel the same on both sides?
It does.
What about here and here?
Yes.
And here and here?
Mm-hmm.
Okay. Very good. Can you go ahead and look up for me? Checking the conjunctiva and look down. Good. Everything looks white, not red or irritated, so that's good. I'm going to go ahead and test a little bit of sensation with the cotton wisp. So I want you to look straight at me, and I'm just going to bring this little cotton wisp in. And the blink reflex is there, and the other side. Good. Okay. Next thing I'm going to just check is to see if you have any sort of nystagmus or if you have any sort of lazy eye. So go ahead and keep looking right at the tip of my nose. I'm just going to pull this card in front of you. Very good. I want you to hold up this card to your left eye. Yep, I'm going to cover the same eye. I'm going to have a finger coming in. I want you to tell me when you see it.
I see it.
Keep looking right at my nose.
I see it.
Okay.
I see it.
Okay.
I see it.
Go ahead, look right at my nose.
See it.
Okay. I'm just going to keep your over that eye. I'm going to just switch my hands.
I see it. I see it. I see it.
Very good. And you can go ahead and switch eyes there.
I see it. I see it. I see it.
Good. And keep that one covered. I'm going to go over here. And it's when you see my finger wiggling.
I see it.
Okay.
I see it.
And one more.
I see it.
Okay, excellent. I'll go ahead and take that from you. So it looks good. There's good peripheral vision there. I'm not sensing any issues with your vision. Did you have any double vision while you were doing that?
No, I didn't.
Okay. So next thing I'm going to do is just take a listen to the temples right next to your eyes. Just want to make sure that, you know, maybe the headaches are actually coming more from like the sinuses or from the blood pressure there versus the eyes themselves. So you can just breathe normally. Good. Okay, now does this feel cold or hot?
Feels cold.
Cold or hot?
Cold.
Okay. Which is warmer? This one or this one?
Your fingers.
Okay, excellent. This side. Is this warmer or this warmer?
Your fingers are warmer.
Okay. Just gonna make a note of that. Check a couple of the cranial nerves to make sure that all of your neurological issues are running normally. There's no issues there neurologically. Can you go ahead and close your eyes really tight? Don't let me open them like you have soap. Good. Okay, and now open them really wide. Raise your eyebrows. Very good. And big smile. And can you puff out your cheeks for me? And hold it there. Okay, good. Can you turn your head all the way this way? And don't let me pull it back. And turn your head all the way that way. And don't let me pull it back. Forward. And against my hand. Okay, excellent. Can you go ahead and shrug your shoulders? Good. And then the last thing I want to do is just have you clench your jaw. Clench. Clench. Okay. I don't sense anything wrong there. We already checked a few other cranial nerves by doing the eye acuity test. Do you have any issues with your sense of smell or taste?
No, not really.
Okay. Do you have any other symptoms when you get the headaches? Like any other pain in your body, aches, or any nausea, or is it just the pain in your head?
Mostly just the pain in my head.
Okay. So I'm just going to do a couple more neurological things, testing your eye coordination. So if you can go ahead and take your finger and touch my finger and watch it as it follows around and touch it as it moves around, okay? So start here and then touch it here and keep watching it and following it with your eyes. And here, one more. Good, and you can try it with the other hand. Here. Good, any pain or pressure on your eyes with that?
No.
Okay. Okay, so I just wanted you to read this up close. Can you tell me what that word says?
It says pomegranate.
Pomegranate. Okay, excellent. And what about the front of this? What does that say?
It says thank you.
Okay. And so no problem reading that. It seems like you're okay, especially with the near vision. Your glasses are for further vision. Have you noticed if you wear your glasses, are you feeling any pain after that?
No, not usually.
Okay. So, I just want to take a quick look up into your nose and in your ears to see if there's any congestion, because that could also cause headaches. So if you can go ahead and tilt your nose back for me. Okay. And if you put your head down. Can you breathe in that side? And the other side? Any difficulty there? Seemed like maybe one side is a little
bit of blockage
on that one side.
Yeah.
Okay, I'm gonna go ahead and check your ears now. Any pain on the outside of your ear?
No, not really.
Okay, check them around here. Any pain here?
No.
Okay. Any pain in your head? Any tenderness up in the back of your head?
No.
Okay. What about your occipital here?
No.
Nothing there. Okay. I'm gonna go ahead and just check your lymph nodes. Let me know if you feel any pain or tenderness. You shrug your shoulders for me. Okay. Okay. So based on my exam, I would say that you're probably experiencing migraines. It's a fairly common thing. It can be very uncomfortable and be very intense when it does come on, and it also can be more infrequent. So it's maybe not triggered every single time you use a computer or see a flashing light, but it can be triggered at any time. Some of the things you can do are things you're already doing. Lay down and rest, turn the lights off. Sometimes noise or visual stimulation can make a migraine worse. And then if you continue to have problems that are not treatable by just some over-the-counter medication, we can look into you can look into visiting with someone who specializes in migraines, and they can maybe help you explore it a little further. But it seems like your eyes visually, you see everything okay. Your prescription seems correct for you. You didn't have any pain or tenderness around the eye itself, and all of your cranial layers were intact. So I'm not too worried about your vision at this time.
Perfect.
Today we're going to be doing a exam of your skin, just taking a look at the overall dermatological health of the skin of your face, the hair on your face as well, and just doing both a physical check and also a check with the light and the magnifying glass. It's really important to get skin checks about once a year or so, just to check for any nevi that might look a little strange. Keep an eye out for skin cancer and anything that could just be bothering you cosmetically as well.
Sounds good.
Before we start, is there anything on your skin that is bothering you at this time?
No, not particularly.
Okay, so you're just here to get checked out, make sure everything's in good shape.
Yeah.
Okay, excellent. So, I'm just gonna make a note. So, when was the last time you had your skin examined?
It's been a few years.
And was there anything abnormal in your last exam?
Not that I know of, no.
Okay. Right. Just gonna go ahead and cleanse my hands so that way I don't transfer any oils on my hands onto your face. It's kind of nice smelling, so an emotional support animal might like that. So I'm just going to start by just checking out your face. Just looking behind the hair, through the top of the hair, checking the hairline. Got a good amount of hair. Do you have any current face maintenance routine? Do you use any lotions or sunscreens?
No, I probably should use more sunscreen than I do.
Okay, can you look that way for me? I'm just gonna check this part of your neck, behind your ears. Alright, not seeing anything there. I'll check a little bit more in the inside of the inner ear, the skin of the ear. Can also be affected. Can you look that way for me? I'm just going to go ahead and check with my light, just especially around the ears and crevices where you can't see quite as well. And I don't see any sort of nevi or moles on the face. Doesn't seem like you're very prone to acne either. Have you ever experienced acne?
Yeah, when I was younger.
But more like in like the regular teenage time?
Yeah.
Okay, so nothing since then. See a little bit of potential sun damage. Look this big. Yeah, thank you. Okay. Just looking inside the beard here. Looks really nice and healthy. I'll take a look with the magnifier as well to make sure that there's no ingrown hairs or any issues. Do you ever feel like you have issues with your facial hair?
No, not really.
On the side. Okay. How often would you say you shaved your face?
Not very often.
Okay. When you do you shave down all the way to the skin, or do you just trim?
Usually just trim.
Just trim. Okay, so you're not having any sort of shaving irritation or bumps, anything like that after shaving?
Yeah.
Okay. Just checking out your eyebrows as well. And those look nice and healthy. Your eyelashes, can you just look up for me? Good distribution there, and good look down. And I'm just going to push your eyelids really gently. Okay. A little bit of redness on the eyelids. That could just be from tearing. If you don't get enough sleep, or if you look at a computer for long amounts of time, that can be causing some redness and irritation around the eyes when your tear ducts are overactive. Alright, so before we go ahead and move on to the next step, which will be looking at the skin and mattification, I'm going to go ahead and just cleanse it. It's going to move any of those oils that are currently just on the surface level from the day off your skin, okay? Do put your lips in for me. Thank you. Okay. So next thing I'm going to do is just use this microscopic camera. Go ahead and look at your face, okay? So it doesn't hurt, it doesn't cause any irritation. All it does is let me look clear at the skin with a little bit of a light, okay? I'm looking up at this forehead. Skin up here looks really good. Super clear. Few discoloration sunspots, but your pores are very clear. Doesn't look like you have much oil in the glands. A lot of times pimples are caused by sebaceous glands, which are most popular on our face, our back, parts of the body where we get a lot of acne. So doesn't look like yours are irritated at all. It doesn't look like they have much oil in them. Do you ever wash your face?
Yeah, when I shower.
You shower, okay. And you just use like soap and water, or do you have a product that you use?
Yeah, just soap.
Soap and water, okay. Is the soap scented or unscented?
Unscented.
Okay, that's good. That's the best for your face. Not seeing any real issues. Like sometimes on the nose you'll have blackhead issues. You definitely do have a few filled pores here, which I can go through and do some minor extractions there, but in general your skin looks really healthy. Just gonna check the other side. And close your eyes. I don't want you to, there's a light that comes with this. And your skin looks great. I'm not seeing too much discoloration. Doesn't look like there's that much sun damage. Like, I know you mentioned that you need to wear more sunscreen, which is good. You should be wearing sunscreen every day. It should be part of your routine if you get out of the shower to just apply sunscreen after in the morning. However, it doesn't look like you have suffered too much skin damage over time, so that's good. Just going to go ahead and check into your beard follicles here and just make sure I'm not seeing any ingrown hairs, any issues that you might be having. It doesn't look like there's any dryness, any flaking, really healthy hairs. You do have multiple colors in your beard, which is pretty normal. It's fairly normal to have color variation in the beard, even if you don't have it on the hair of your head. Good, I'm not seeing any sort of ingrown hairs. This side. Everything looks super healthy. Have you ever seen it magnified before?
No, I haven't.
It's a very interesting thing, but keep in mind this is times like 50 or 100 times, so everything you're seeing, even though it might look like, oh wow, that's, you know, that's a big issue on my skin, it's so small. It's very very microscopic, literally. So yeah, okay, this all looks great. I'm going to just do a couple of quick extractions on the nose. Your skin's really clear, you just have a couple of blocked passages there. It shouldn't hurt, but if there's any pain, let me know. I'm just using some fresh gauze here. That way we don't actually enter any oils into your skin while we're doing the extractions. So basically what I'm doing is really simple. I'm simply squeezing out any oils that might be inside the pores, wiping them away. Let me know if you can't breathe for any reason. Try only do one nostril at a time. Just going to grab underneath here, okay? Does that hurt at all?
No.
Okay, good. Pores are generally larger in the nose area, which is why a lot of people might find that they're having, blackheads there even though they don't have them anywhere else. They can fill up with more oil and cause these blemishes to occur. There's also a lot of misconceptions about acne, that it's, something that only happens during your younger ages, and that's true because hormonal changes can definitely drive a lot of oil and sebum production in your skin. But it's not exclusive to someone in their younger years, and it really just depends person to person. It's not dangerous in any way. There's one up here I'm going to look at. It's not dangerous in any way. It's just people don't like it because it doesn't look good. I'm going to check for anything else. Your skin is very, very healthy. Can you look up for me? I'm hiding one right here. I'm just going to look at that. Okay, I don't think that one's quite ready yet. If it ever comes to the surface and you're going to squeeze it, which I recommend you don't because that can cause scarring, it's better to let a professional like me do it. But definitely if it's underneath the skin still, it's not ready to, the oil has not made its way to the surface and it's not ready to be cleared out. Okay. Alright, I think that looks good. The last thing I want to do is just trim your eyebrows just a little bit if that's okay. There's a few that I think can potentially turn into issues with ingrown hairs if they're not taken care of. We don't want them to sort of get tangled in each other and cause issues at the base of the hair, at the follicle of the hair, okay?
For sure.
So I'm just going to cut a fresh piece of gauze here to catch any hairs that fall so they don't go into your eyes. Go ahead and close your eyes for me so I don't accidentally get any hair in your eyes as well. Last thing I'm going to do is just apply a little bit of sunscreen for you before you head out.
For sure. Thank you.
No problem. It's important to get full coverage. And the top of the ears as well can often be missed by people, as well as the neck and behind the neck. When you go out and the sun hits the top of those ears, that skin can also be affected by skin cancer. Okay. So I'm just going to suggest that you come back in a year. I didn't see any moles or nevi that worried me. If you do see anything, remember the acronym ABC. So if it's if it's asymmetrical, if its borders are changing, or if its color is not consistent, you can go ahead and come in and have those checked out.
Awesome.
I'm going to be doing a musculoskeletal exam on you today. So I hear that you're having some issues with your shoulder. Which shoulder?
The left shoulder.
Left shoulder. Okay. So I'll definitely want to take a look at that today, as well as everything else. I'm kind of going to go head to toe. So when I get to your shoulder, I'm going to ask you a few more questions about it. Okay?
Definitely.
Are you in any pain right now on a scale from 1 to 10? 1 being no pain at all, 10 being excruciating pain.
About a 2.
About a 2. Okay, so it's a little pain and tenderness right now. Okay, so if I'm hurting you at all when I go through, let me know so I can stop and adjust. What today is going to involve is just doing some testing of your mobility, your strength, your flexibility, swelling, edema, anything of that nature. And then we'll definitely check out that left shoulder as well to see what's going on there. Okay?
Sounds good.
All right, great. So, like I said, I'm going to go from top to bottom. So for starting out, can I just see the flexibility of your neck? Go ahead and lean this way. Good. And the other way. And backwards. And forwards. Any pain with that?
Just a little on the left side.
A little bit. Okay, so like where it leads into that shoulder. I'm gonna go ahead. Do you mind if I just palpate while you do that, so I can feel any crepitus? Go ahead and lean this way again. Okay, and this way. Yeah, definitely sensing more limited range of motion on your left side than on your right side. And lean back down. And back. Okay. Good. So next thing I want to do is just test the strength in that area. So do the same thing, but just push a little harder on my hand. So push that way. Good. This way. Push back. And then forward. Yeah, definitely a little bit of weakness. I'd say 4 out of 5 on that left side and 5 out of 5 on the other side. Nothing too concerning. So I'm going to go ahead and move on down to your shoulder area. Now I'm going to be really gentle with the left side, so let's start with the right. Can you go ahead and make a circle with that right arm? Any pain there?
No.
I'm just going to feel for any crepitus or popping while you do that. Checking the joint here, the shoulder joint. All right, you can relax. I'm just going to palpate the shoulder joint here. Any tenderness when I'm touching that?
No.
Okay, I'm not feeling any swelling. Go nice and loose. I'm going to move the arm for you. I'm just feeling that muscle that connects the neck to that shoulder joint. Okay. I'm gonna have you cactus out for me like that. And can you go up and down? Internal rotation, external rotation, and any problems with that?
No.
Okay. You can go ahead and put that down for me. Now I'm going to check out the side that's been bothering you. So do you remember hurting yourself at all? Anything that started?
I think it was just like lifting weights.
Okay.
So,
Yeah, you're just at the gym one day, and
yeah.
did you feel something happened at the time, or is it more like you got home?
More like I got home.
Okay. So, and is it a sharp pain? Is it throbbing pain? What kind of experience is that?
It's more like a sharp pain.
Okay, a sharp pain. Okay. And is it when you're relaxing, or was it with movement, or all the time?
It's usually with activity.
With activity. Okay, so if you're just chilling, if you're resting, you said you're about a 2 right now, so maybe it's a little bothersome, but not really.
Exactly.
When you are working out or moving that arm, what does that pain number go up to?
Maybe like a 5 or a 6.
Okay, so bad enough where you might want to stop the activity,
Yeah.
but like not, let's go to the hospital. Okay, I'm going to go ahead and examine this arm. Can you make a circular motion with it? How does that feel?
Not great.
Not great. Does it feel worse going up or coming down?
Coming up.
Coming up, okay. So I'm just going to feel there. I'm just going to palpate.
Mm-hmm.
You can just relax. I'm going to take the weight of your arm. Yeah, I definitely feel a little bit of swelling in the shoulder joint here. I'm just going to feel underneath here. And give me all your weight. Any pain when I press on this muscle here? Or is it more like when this goes up and down?
A little bit of pain.
A little bit of tender. Okay. Is it like sharp pain or more like tender?
Maybe tender.
Okay, yeah. That might be just from compensating from the shoulder being not the best. All right, I'm gonna move the arm for you. Again, go nice and loose. And let me know when the pain starts getting bad.
Yeah.
Right there? Yeah, that's about as high as you can go. Okay, I'm not going to push it. And I'm going to go ahead and move it backward for you as well. Let me know, is that pain helpful at all?
No, not really.
Not really, okay. And what about if I go internal like this?
That's okay too.
That's okay, so it's just coming up like this.
Mm-hmm.
Okay. So go ahead. I'm just going to feel the back muscles as well. Just palpating. I do feel a little bit of like a popping sensation when I move your arm a little bit up. Okay, go ahead and set that down, relax. So what I would guess is that you probably just hyperextended a little bit, and that joint's just a little bit of swollen. So when you're moving your arm upwards, you're getting that engagement of that swelling there, and it's kind of in your way and it's causing some pain and tenderness. Definitely ice it, take some ibuprofen for it. If you're working out, maybe try to avoid doing a lot of shoulder activity for a couple of days, but it should feel better soon. If it doesn't, come back in, we'll do some x-rays on it, okay? All right, so I'm just gonna go ahead and move on down to your elbows now. So let me know if there's any pain along the way. First thing I'm gonna do is just feel as I move the joint here. Okay, you go ahead and extend outward and contract. And then if you have it out like this, sort of move it side to side. Put it right at that elbow joint there. Good. How did that feel?
Feels okay.
Feels okay. Okay. So I'm going to test this side now. Same thing. I'm just going to palpate that. Don't feel any swelling, any pain when I poke that. There. Okay.
No.
And same thing. Can you go extend, contract, and then side to side. Good. Okay. I'm going to have you put both arms out. I'm going to test some of the strength. Can you try and turn your hands inwards like that? Yep. And the other way? Good. And now put your arms up, pull away from me, and push against me. Good. Go ahead and set that down. Everything there felt fine. Any pain for you?
No.
Okay. I'm going to do your wrists next. So again, let me just feel joints. Feels good. Any pain?
No.
Okay, this side. Okay. I'm going to do the same thing, some range of motion. Go up like that and down. I'm going to hold your wrist, go side to side. And I have out like this, like that. Yeah, perfect. Good. And on this side, side to side, and then up and down. Okay. I'm going to go ahead and do some testing for carpal tunnel. Do you work on the computer at all?
Yeah.
You do, okay. So what I want you to do is just fold your hands inward like this and hold it there for a few seconds. You feeling any tingling in your fingers or your wrists?
No.
No? Okay. All right, you can go ahead and release. I'm just going to tap on the inside of your wrist here. You getting any pain, tingling there?
No.
Okay. This side? Nothing. Okay. Do you ever feel like when you're working on the computer, your hands are cramping up or you're having any issues with numbness, sensation loss?
Not really, no.
Okay, good. Just keep track. The computer definitely does sometimes cause some carpal tunnel issues in the nerves in your hands, but it does tend to happen when you're a little bit older. So glad to hear that everything's good. Next, I'm just going to go ahead and look at the joints in your fingers. So go ahead and I'm just going to palpate first. Just feel each joint. Do you have any issues in your hands with stiffness, trouble grasping?
Sometimes.
Sometimes. Is it more in the morning or the nights?
Mornings.
Mornings, okay. So it's kind of like after you wake up and move around a little, they feel a little looser?
Mm-hmm.
Okay. Does it tend to get worse in the winter or the summer at all?
No, not really.
Not really, okay. Yes, a little bit of swelling on your joints, but nothing too concerning. I'm not seeing any signs of bulbousness. That would mean arthritic tendencies or anything like that. So go ahead and do some range of motion. So can you close your hands nice and tight? Spread them out. Can you spread your fingers out wide and close them together? Okay. Go ahead and put your hands up like this. I'm going to try and push your fingers. Don't let me put your fingers. Okay, put your fingers like this. Don't let me pull them. Go ahead and put your hands up like this. I'm going to try and push your thumb down. Keep it up nice and strong. Good. Okay, you can go ahead and put your hands down. I'm just going to go ahead and rip off a little piece of paper. You go ahead and stick your hands out kind of like that. I'm going to slip this piece of paper in. Don't let me pull it from you. Good. And on this side, you can let go. On this side, in the hands, don't let me pull it. Good. Nice and good strength there. So I've got 5 out of 5 strength in your hands, your upper body. I'm going to go ahead and move down to your lower body now, okay? So before we start with your lower body, any pain in your hip joints? Any difficulty walking?
No.
No, okay. I'm going to have you just stand up right next to the chair here. Good. So you can go ahead and hold on to me if you need, but can you go ahead and pick this leg up? Good. And down. And this leg up. Good. And down. I'm just going to feel the hip joints. And are you able to sort of swing your leg backwards at all? Good. Any pain there?
No.
Okay. And this side? Good. Okay. All right. I'm not seeing any swelling or problems there. You can go ahead and take a seat again. We're going to move down to your knees. So do you have any history of problems with your knees?
No.
No. Okay, good. Do you, for a physical activity, I know you lift weights. Do you do any, cardio, any running, walking?
Yeah, I do some running.
Biking, anything like that?
Yeah.
Okay, good. Running can definitely be difficult on the knees, so you may develop problems later. So just make sure that you're taking necessary breaks in between and mixing it up with some biking as well. So if you want to just extend your leg out and just set it right here. I'm going to go ahead and grab it. Is that okay?
Yeah.
I'm just going to go ahead and palpate the knee. And behind. Right, I'm not seeing any swelling. Doesn't feel warm to touch at all. Okay, you can go ahead and put it down for me. And can you go ahead and lift up against my hand? Good strength there. And then can you go outwards with your leg. That's also testing your hip, and come back in like that. Good. Right, and on this side I'm going to do the same thing. Can you go ahead and I'm going to lift this up gently. Okay. Just palpating the knee, palpating behind. Okay, and same thing. You can just go up and down with it against my hand, nice and strong, nice and strong. Good. And outwards and internal. Good. And any pain and issues there?
No.
Okay, excellent. Okay, lastly, I'm going to move down to your feet. So if you don't mind going ahead and lifting up your foot again, I'm just going to hold on to it. I'm just going to feel your ankle bone joint. And go nice and loose. I'm going to just move it around a little bit here. Good. No spasms, anything like that. Can you pull your foot back? Sorry, pull your toes backwards. Yeah, perfect. And then forwards. And can you go side to side? Good. And just do that against my hand for strength. Backwards, forwards, and side, side. Good. 5 out of 5 strength on all sides. I'm just going to go ahead and palpate the toes while I have this foot up here. And just push down on this big toe for me. And can you pull back? Excellent. Good strong foot. You have a nice high arch. Just feeling your heel bone. While I'm here, I'm just going to go ahead and check some of your reflexes as long as I have you. So go nice and loose. I'm just going to get your Achilles. Go all your weight on me. Good. And I'm going to just scrape this on the bottom of your foot. It's a Babinski reflex, so it's going to feel a little uncomfortable. Good. Okay, you can go ahead and put that down. I'm just going to check your patellar reflex on this side, so just let your leg go floppy. Let me take all the weight. Good. Okay, so I'm just going to go ahead and check the patellar on this side too, so go nice and loose and floppy. Finding that tendon there. Good. And I'm going to lift you up on my leg here, and I'm going to go ahead and check out your ankle as well. Alright, so I'm just going to check out the ankle on this side, so I'm palpating the bones here, checking for any edema, swelling. Go ahead and pull your foot back and forward and side to side. Good. And a little bit against resistance. Forward, side, side. Let me quickly check your toes. Okay, and I'm going to go ahead and just get those 2 reflexes while I'm here, so nice and loose. Good. And the Babinski again, a little uncomfortable. Excellent. Okay, go ahead and put that down. All right. Last thing I want to do is just go back and just take a quick look at that shoulder of my pen light. I just want to look for any bruising or swelling or redness that I might not have seen on the surface. Is it okay if I pull your shirt back a little bit?
Yeah.
Okay. Just looking to see if you're having any bruising down and through the muscle. That could be a sign that you tore something or that there's some sort of ligament issue. Not seeing anything. A little bit of redness, but that could also be from rubbing it if it didn't feel good. Okay. Okay, so like I said, if your shoulder gets worse after a little bit of rest and icing, let us know. We'll x-ray it to make sure that there's no tears or no microfractures in the shoulder itself. But otherwise, I think it just takes time. Just tweaked it a little bit.
Sounds good. Thank you very much.
Today I'm going to be doing a spine assessment, checking out all the muscles along your back as well as range of motion and your strength. Is that okay?
Sounds good.
Okay, excellent. I'm just going to sanitize my hands. Great. So first thing we're going to do is just assess your range of motion. So just mirror what I'm doing and let me know if there's any pain when you do it. So twist this way at your spine. I'm just going to hold on to you while I do it and twist that way. Good. And then can you put your arms all the way up? Any pain there in the back along your neck?
No.
Okay. And all the way down and back. Any pain there?
No.
Okay. Can you turn your head to tilt your head to the side? And the other side? Any pain with that?
No.
Any tightness one side or the other?
No.
Okay. And can you go forward for me? Tilt your chin all the way down to your chest. And on backwards, tilt it the other way. Any pain there? Okay. I'm going to have you go ahead and reach down. Or can you turn around for me? You go ahead and bend down and touch your toes. And as you come up, I'm going to go ahead and feel your spine. So come really slowly, one vertebrae at a time. Good. Coming. Good. Okay. Any pain with that?
No.
Any tightness in the low back?
Not really.
Okay. Can you lean backwards to arch your spine? Yeah, just like that. Okay, good. So full range of motion in the spine. All right, last thing I'm going to do with range of motion is just check the lower spine and sides of the hips. So I'm placing a stool behind you. If you can look back, see where it is. And go ahead and sit down gently. Okay, no problem with that. And can you stand back up? I'm just seeing, and just do that one more time. I'm just looking at the back and how it goes down. Okay, and while I have you seated here, if you could just look down, I'm just going to look at the neck here. Do you often get headaches in the bottom of your head at all?
Not really.
Not really? Okay. So a little bit of tightness. I'm just going to feel the muscles next to the spine. Any different pain, anything up that way?
No, not really.
Okay. All right, you can go ahead and stand up for me and turn back around. Okay. Now I'm going to go ahead and test some of the strength. So I'm going to do the same thing we did with the range of motion, but I'm going to put resistance against you.
Okay.
So while I'm holding your side here, I'm going to want you to bend your spine laterally, and I'm going to try and resist. So try and do it nice and strong. Good. Nice strength there. Same thing on this side. Good. Nice strength there. Now try and sort of twist against me. Yes, perfect. Good. And on this side. Good. And then if you turn around, I'll do the, and you bend down for me. And then just sort of push against my hands here. Try to pull up. Good. And then up here. Good. And then as you push back, push against my hand. Excellent. Any pain with that?
No.
Okay. Strength was 5 out of 5 in all spaces. So the next thing I just want to do is move you down to the mat and assess some of the temperature sensation of your spine and check out some of the muscles, see if we need to do some adjustments or gua sha at all, okay?
Perfect.
Thank you so much. Okay, so the first thing I'm just going to do, I'm going to lift your shirt up a little bit here. I'm just feeling for the temperature. Make sure it's consistent along the spine. Definitely feeling a little bit more heat in the top of the back than the lower back. Okay, I'm just going to palpate all the way down the spine here. Tell me if anything hurts. No pain?
No.
Okay. I'm going to do a little bit deeper now. Just feeling muscles on either side of the spine. There's definitely some tightness. Okay. Just gonna look at the curvature while you're laying down here. There's not quite as deep of a U as we normally see. It does feel like there's Not too much muscle tension down there, so that's good. I'm going to go ahead and just test for some sensation. Just tell me if you can feel this all the way down your spine. Can you feel that going down your spine?
Yeah.
All the way?
Yeah.
Okay. This side? All the way down? Feels the same?
Yeah.
Okay. I'm going to do the same thing with some sharp touch. Just let me know if it feels sharp all the way down. Feeling sharp?
Yes.
All the way?
Yes.
Okay. How about on this side?
Yes.
Sharp all the way. Okay. I'm going to tap on your vertebrae here. And if you have anything that, anything that's a shooting pain or sharp pain, let me know. Sometimes, you can have some nerve damage along the spine. And even if it doesn't hurt the muscles to touch, it can hurt on the actual bone structure itself. So just let me know. Any pain?
No.
Okay. Can you go ahead and lift this leg up from your hip? Yeah. Okay. And on the other side? Is that leg a little harder on this side to do?
Not really.
Feels about the same. Okay. Just move up to your neck here. Just feeling along the trapezius muscle. Okay. Only a little bit of tightness. Yeah, more up top than on the bottom. Okay. So what I think I'm going to go ahead and do is do a little bit of gua sha on the top part of your back here, between your scapula, because that's where I'm feeling most of the tightness and tenderness. I'm not sensing any issues with heat and, suggesting that anything's out of place in alignment. I am going to do one slight adjustment here, just right in the top before we do some gua sha. So go ahead and take a deep breath in for me. And let it all out. Good. I think there's one more in there, so turn your head to the side so that you don't, and take another deep breath in and out. Good. Okay. If you don't mind, I'm just gonna scoot this part of your shirt up. Is that okay like that?
Yeah.
Okay. All right, you can settle down. I'm just using a little bit of lemon essential oil to lubricate the spine here. And sometimes gua sha can cause a little bit of redness. Basically what it does is bring some of that dead fluid or skin up to the surface. You feel that big lump there?
Mm-hmm.
Is that painful when I do that?
Mm-hmm.
Okay, sorry. It's one of those hurts so good kind of things sometimes. Feel a little bit of heat coming in there.
Mm-hmm.
Yeah, that's normal. It's basically just bringing blood to the surface to start the healing process. Do the other side. Yeah, this is even a little bit more tense on this side than the other side. See some of that fascia coming up. Alright, so I would say that for now, your spine's in pretty good shape. I would just watch the tension in the upper back. Some things you can do are, use a roller to roll out these muscles here because you're holding a ton of tension here. You may also want to, get a professional massage or go to some sort of yoga class that can help you really stretch out this portion of your body because the lower back, everything feels pretty loose and fine and flexible, but I'm definitely sensing the tightness in the top here.
Sounds good, thank you.
No problem. What seems to be the issue that you're having? You said over the phone that your left ankle was bothering you, is that correct?
Yeah, that's correct.
Okay, well, as a physical therapist, what I'm going to do is just take a look at making sure you're neurological, everything's intact. I'm going to ask you some questions about what happened and any injury that might have occurred. Do some physical testing to make sure that the nerves are all intact. And then lastly, just show you some exercises that you can do to strengthen that ankle. Does that sound okay?
Sounds perfect.
Amazing. So are you in any pain right now? On a scale from 1 to 10, 1 being no pain at all, 10 being the most pain you've ever felt?
Probably a 5 or 6.
5 or 6. Okay, so it's hurting even just sitting here, right, like this?
Yeah, a little bit.
Okay. Do you have any memory of something happening? Did you fall? Did you have an injury?
I think it was a running incident.
Oh, you're running. Okay. And how often do you run?
Quite a bit.
Quite a bit. Okay. Would you say between like 2 and 4 miles a week, 5 and 10 miles? Like, do you have how often?
10 to 15.
10 to 15. And in what increments are you running? Smaller amounts or?
3 miles.
3 miles, so about 3-4 times a week. 3 miles. Yeah. Okay. So that's quite a bit. And how long have you been running?
A few years.
And have you ever had any issues before with this ankle?
Not too much.
Okay. And was there like a specific moment? Do you mind if I roll this up first?
Yeah. You can look.
Oh, perfect. Was there like a specific moment where you fell, or just after one run it just started hurting?
Yeah, just after one run.
Okay. Okay, so I'm just going to press around a couple of spots. What if I press on this outer bone right here? How does that feel?
That's okay.
That's okay. What about on the inside on that tendon right there?
That hurts a little bit more.
That hurts a little bit more. Okay.
Yeah.
I'm just going to compare it to the other side of your foot as well. Check for any swelling while I do this. Okay. So same thing on the other side. That outside bone, does that hurt at all?
No, not really.
And the inside tendons, okay.
Yeah.
Okay. So I definitely do feel a little bit of swelling. I'm just going to go ahead and measure. See if there's any big difference in the ankles. Oops. Okay, so it's about 8.5 around. And that one's a little under 8. So yeah, there's about a 1/2 inch of swelling around the ankle on that left side. Okay, I'm gonna make some motions now with your foot. If it hurts too much, just stop me. But otherwise, let me know if that pain increases on that scale from 1 to 10. So if it jumps up to a 7, let me know that. And just let me take the weight of your foot here. Does that hurt?
A little bit, yeah.
Okay. Up from like 4 or 5 to like a 6, 7 kind of thing? Or
yeah.
Okay. What about down like that?
A little bit, yeah.
Okay. How about side?
Yeah.
That hurts a lot more to side.
Mm.
Same on both sides?
Yeah.
Okay. And on this side is just make sure. Does that hurt?
No.
No pain there?
No.
Okay, that's good. I'm going to do a couple more tests. Based on initial thoughts, it does look like you might have sprained your ankle. You've got this classic swelling and the pain sensitivity around there, but I just want to make sure that neurologically there's no issues, that you're not having any tingling or weird sensations in your feet like that. That could be a sign that something else is wrong. So do you mind if I just remove this sock on the side? Okay. And here. All right, I'm just going to start by testing some sensation in your foot to make sure you're not having any sensation loss. You feel that softness right there? So it's quite light. I'm going to do it on the top, the bottom, on both feet, just to compare side to side. Just say yes when you feel it.
Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Okay, good. No light sensation issues on either side. Now I'm just going to do some sharp touch. So see how that's kind of pointy like that? So just go ahead and tell me sharp, or see how that's much duller? Sharp or dull. Okay, go ahead and close your eyes.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Good. And the other side?
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Very good. So it doesn't look like you have any neurological issues, which is great as far as sensation goes. I'm just going to check a couple other things. Can you go ahead and press down your big toe for me? Good. And on the other side? Excellent. And now the whole foot, if you just put your feet up like that, sort of press down. Press down hard, like you're stepping on a gas pedal. There you go. And pull back against me. Okay. Definitely a little weakness on this side. Can you push out? Okay. And come in. Okay. Yeah, see, I definitely feel a lot more weakness here. Was that painful when you tried to do that?
A little bit, yeah.
Yeah, okay. I could definitely tell that you were not as strong on this side as you were on that side. So, and last thing I'm going to do before we go into some of the exercises is just check the feet for any sores. Sometimes we can have some issues hiding in between the toes. People who have issues with their feet or diabetes can definitely have some issues with their feet, or their ankles. So make sure we're not missing anything major. Okay, that looks good. All right, so I think what we're definitely seeing here is a swollen ankle. You probably just stepped wrong during running, and it sort of stressed the tendons, and you bruised the tendons in there. And so I think probably on this side, I can feel the swelling all around, but your weakness when you were doing some of the strength tests was worse on the inside than the outside. So I'm going to show you a couple of exercises you can do to strengthen it. Also, make sure to ice it, ibuprofen. But until then, just little exercises that you can do. This is called a resistance band. And what you would do is loop it around the top of your foot here, and you'd hold it with your own hand, but I'll hold it for you for now. And just start doing some strength exercises against resistance. So really slowly pushing your foot down in this direction until it hurts. And come back. And again, do it like 3 times. Once more. Good. Okay. And then after that, you're going to pull it to this side. Come this way. 3 times. Good. This way. Same thing. Good. So what's that's going to do, do that a couple of times on each side. What it's going to do is just start strengthening up those muscles around here, because right now they're sore, and the more you stay off of it, because it hurts, the less the muscles are going to be able to be strong, and you're more likely to be prone to injuring it again. So I'm going to go ahead and put your socks back on. And before we leave today, I just want to make sure that there's no problems that radiated up your leg, and there's no swelling up your leg. So I'm just going to give those a quick exam. I don't think I'm going to see anything, but let me know if you feel any pain. Any pain there?
No.
Any pain in the knee?
Not really.
Okay. How about here?
No.
In the knee. Okay. Can you sort of bend your leg up like you're going to be taking a step? Like that. Okay. And I'm just going to pull. Don't let me pull you. I'm like, pull your leg back towards you. Yeah, there you go. And push towards me. Good. And on this side, same thing, pull and push. Okay. Okay. Good strength there. And you didn't have any sensation loss when I was touching you?
No.
No, okay. Yeah, I think I'm just going to recommend you go home, take a couple of days to ice, do those exercises, and if you're still in pain, you can come back and we'll take a look again.
Sounds good.
Do you have any other questions?
I don't.
Okay. Thank you for coming in.
Thank you.
And I hope you feel better soon.
Thank you. Appreciate that.